Hello and welcome to a special interview for The Wire supported by Glenlivet Books. Perhaps understandably, the discovery of the Omicron variant of COVID-19 in South Africa and Botswana has frightened the world. But are we right to be so terrified, or is this somewhat of an overreaction? After all, a lot depends upon the situation in the ground in South Africa. And joining me today from Pretoria to explain the situation in her country is the chairperson of the South African Medical Association, Angelique Coetzee. Dr. Coetzee, you've heard the descriptions being quoted by the BBC. Some scientists have said this variant is horrific. Others have said it's the worst ever. But you're there in South Africa. So as chairperson of the South African Medical Association, how do you view Omicron?
Good morning, and thank you for asking our opinion here. We're honored by you and your team. Karan, so what we need to understand is that our infectivity rate was up until the 16th, even actually that whole week of the 16th, still under 1%. And only recently, this last week, it increased, and yesterday it was a 9.7%, if I'm not mistaken. So what does it mean? It means that we haven't seen for between 8 to 10 weeks any new COVID or really an increase in any COVID cases. So on this 18th, I started to notice that day because the first patient that came in was a young man of 30 years of age, and complaining of a type of a fatigue and a body ache and pain and a bit of a slight headache. So for me, also involved in the background with the Ministerial Advisory Committee of the Minister on vaccines, I am aware of what is happening in the field of vaccines. So I decided, because this sounds like a viral infection, to double check on his COVID status. So I did a quick test, what we normally call a rapid test. The rapid test came out positive. But at that same stage, he also made an appointment for the rest of his family, except the baby of 4 months that was also not feeling well. And this patient was incidentally not vaccinated. So I then tested the rest of the family, including the baby, and they were all positive. But none of them severely ill. The baby, no symptoms, and up until today, still no symptoms. Thereafter, I saw 7 more patients with this type of very mild symptoms. And because I am part of the committee, I WhatsApp and said, guys, listen, there's something else going on. I have seen cases today that's not similar with the clinical picture and then Delta. This looks like more like Beta, or maybe there's another variant. At that stage, we was not aware that there is a variant going around. And simultaneously, our labs in the background started to pick up on the PCR test that there's also an unusual pattern. They also alerted. And only last week did the sequencing came out and say, yes, there is a new variant. But from there until this morning, the cases that we are seeing is more or less similar, quite mild. We're not saying that patients being admitted to ICU will have a different picture. They will, obviously, if they are admitted, they will have severe disease. And as primary healthcare practitioners, we're not really seeing any severe cases that needs admission. So those patients that would need admission would most probably go directly to the casualties and being admitted. But again, the load on our private hospitals in this region where we are practicing is not seeing a huge influx or uptake of COVID-19 patients.
2-3 quick follow-up questions, Dr. Coetzee. You're saying that the patients you've seen do not show severe symptoms. They show mild symptoms, fatigue, tiredness, headache. And initially you thought, in fact, it was a viral infection. It is only when you did a rapid test that you discovered it was COVID. But then the first gentleman who came to you, who was unvaccinated, you tested his family and you discovered practically all of them had been infected, including the little baby. But even so, none of them have severe symptoms. Have I understood that part correctly?
Yes, you understood it correctly. And again, I spoke to my other colleagues in the Pretoria region as well, and the picture is more or less the same. None of them had seen severely ill patients. We're not saying that that's not going to happen. Remember, early in any wave, you will see your younger patients coming in with symptoms, and then it would spread further. But also, that gives me a bit more comfort is that we have seen a few patients that has been vaccinated with breakthrough infections. And again, symptoms extremely mild. So this morning I received the positive test of a lady that I saw on Friday, 66 years of age with quite a lot of comorbidities. When I saw her on Friday as well, very mild symptoms, and she's been vaccinated. And so if she's not severely ill, I'm extremely happy. We acknowledge that the whole clinical picture might change going forward. So we are aware of that. Okay. But this is what we are seeing for now at the primary healthcare level.
In fact, what you're saying, and again, I'm just putting it for the audience so they can understand it clearly, you've got corroboration from other people in the Pretoria region where you are, and their impression also is that cases that are coming in have mild symptoms. In fact, if I understood correctly, none of the people you've seen have had needed to go to ICU. There may be some who've gone directly to ICU. We don't know about that. But none of the patients you've seen needed to be admitted to ICU. And more importantly, a 66-year-old lady who was vaccinated but has a lot of comorbidities, both on Friday and today, Monday, did not show severe symptoms. So actually, just to sum that up, all the patients you've seen have had mild symptoms.
Yes, and so my colleagues that also at primary care level, they confirmed
what I'm saying. Question. AFP, the French news agency, reported yesterday that you've personally seen 30 cases. Maybe the number has gone up since then, and this is over the last 10 days. Do you have any idea whether the majority of these were vaccinated, partially vaccinated, or unvaccinated?
So we ask the patients, nearly 50% is unvaccinated, and the rest are partially vaccinated, with 3 patients fully vaccinated at this stage. And the 3 patients fully vaccinated, 2 of them above the age of 60. Again, mild disease. The one lady that I was supposed to follow up today, incidentally phoned this morning, says she feels so fine, great. There's no reason for her to come in to make sure that she's fine, because she is fine. And this is not anecdotally. We've got a documented proof of this, and this is where we are. But again, we're not saying going forward that we're not going to see severely ill people, but this is the clinical picture at this stage. 2 weeks from now on, it might change, and it would always be good to follow up and say, what are you now seeing? But it is also important to understand that you will have the scientists in the background severely worried about the lot of mutations, also acknowledge that they don't know what this is going to mean. Would it mean that it's going to escape the immune system, the vaccines?
Let's, Dr. Coetzee, come to those critical questions one by one, because you've given us an overall impression of the cases that you as a clinician have experienced and seen over the last 10 days, and is corroborated by what others in the Pretoria region where you are have said to you. All the cases that you know of that you've seen personally are mild infections. That includes people in their 60s and mid-60s, people who have comorbidities. They continue to feel well. In fact, one person said she felt so well, she saw no reason why she should come to you. All of that's hugely reassuring, because up till now, we believe that the cases are mild. Now, I should point out to the audience that the first officially reported case in South Africa was on the 24th. Today is the 29th. That's 5 days ago. Botswana reported its first case 2 days earlier on the 22nd. But for the first 5-6 days, all the cases are mild. Let me at this point, because there is an audience listening to you, put to you specifically the 3 key questions that are asked about a new variant. The first is it more transmissible? What's your feeling compared to Delta? And before you answer, let me quote to you what Professor Tom Wenceslas, I hope I'm pronouncing his name correctly, a professor of biology and biostatistics at Leuven University, has said. He said he believes Omicron could have a six-fold higher R value than Delta. And that's frightened people. Because anyway, Delta is more transmissible than any of the other existing ones. So six-fold higher than Delta would be petrifying. But from your experience, both as a clinician and in the Pretoria region, what's your assessment of the transmissibility of Omicron compared to Delta?
I think it's more or less the same. I don't think it's actually, but this is no anecdotal. I think it's the same. We haven't seen that there's that huge a spread, but again, this is the level of the scientists. So just to give you an indication, yesterday in the Gauteng region, 12,300 people who have been tested, and only 2,300 has been positive. So, and then again, this coming week will be very interesting to see how many of them are really going to get severe disease, and how many of the people that we have seen since the 18th, as today is actually day 12 for them, whether they are going to deteriorate. But my own surgery and my colleagues, we haven't seen that picture yet. So going forward, it would be interesting.
So you don't accept that Omicron is six-fold higher in its R value than Delta? Your experience doesn't suggest a six-fold increase.
At this stage, I don't think so, but I'm not a scientist on that. If they say it's highly transmittable, let's see what happens to the South African numbers going forward. And then again, you have to look at severe disease versus mild disease. So mild disease is where you can treat the patients successfully at home, hopefully self-limiting, no need for oxygen. If we can stay like that with only a few patients being admitted with severe disease, then
can I interrupt and ask this? Given your personal experience and that of your colleagues in the Pretoria region, and it's all the same, how do you explain the fact that the infectivity, because you gave me these figures, has gone up from under 1% to 9.7%? Doesn't that suggest that this variant is very transmissible?
Yeah, but that's what we say. We say it is transmissible. We say it is more or less, at this stage, we think it's the same than in Delta. Okay. That's what you see. But on the specifics of that numbers, that's for the scientists. I can give you an explanation on the clinical picture and what we are experiencing. So it's not less transmittable than the Delta variant. But you also need to look at the severity of the cases. So that might change going forward. But
I'll come to severity in a moment's time. But on transmissibility, which is the first issue people look at when they talk of a new variant, your impression, and I'm saying it's your impression, but it's corroborated by your colleagues in the Pretoria region, that it's more or less the same in terms of transmissibility and infection as Delta. Let's then come to the second issue that matters when you are faced with a new variant. The question, does it lead to severe illness? Now, that in a sense you've already answered. All the cases that you've seen and your colleagues have seen in the Pretoria region have been mild, and this includes, I'm repeating, people in their 60s, people with a lot of comorbidities. One of the ladies, in fact, said she felt so well, she saw no reason why she should come back to you. So as of now, am I right in saying all the illness you've experienced is mild, there's no severe disease, but this is only the 5th or 6th day. We don't know what would happen over the next 8, 9. We have to wait 2 weeks.
Yes, absolutely. So we can say that for now, we are quite confident that hopefully this the infectivity, the severity of the infection would stay mild. But that might change. We don't know going forward. And again, these patients that we have seen so far didn't progress to severe disease. So that's a plus point. But again, it might change with new patients being infected that we will only know by the end of this week or next week what is happening there. And then it is compulsory. If you have a positive patient, you have to report it to the NICD. They are directly linked with our vaccine register. So that data will also be available, hopefully within 2 weeks from now, to see how many patients have been vaccinated with breakthrough infections. And then the hospital admissions, because that's where your severity is going to lie, that will only become available within the next 2 weeks. But
So,
for now,
on that question of hospital admissions and ICU in particular, what is the situation? What is the picture in South Africa today?
Today, in the Pretoria region, in the private sector hospitals, not a lot. Not, I spoke with one of the specialists yesterday, intensivists, and she only had one patient on a ventilator. One or two admissions so far. There's nothing at this stage to say, yes, that's going to be, patients are going to get severely ill. But however, that might change. And it is important for people to go and get their vaccines.
Absolutely.
So,
but the clear picture is at the moment, in the Pretoria region, the region where you are, and you're talking about private sector hospitals, there is no pressure in terms of either hospital admission or ICU. It's a comfortable, manageable situation. It's not a problem at the moment.
Yes, and that this is not anecdotal. This is facts.
The third key issue when a new variant emerges is the question, will it escape immunity? Either immunity given by previous infection or by vaccination. Now, South African scientists have done a remarkable job detecting B11529 so speedily. It's literally taken the world by surprise, and they deserve a lot of praise for the speed with which they've done it. Do these scientists have any idea whether this particular Omicron variant is immune escape as far as vaccines are concerned, or is it just too early to tell?
It's still early days. They do suspect that it might, because of the type of mutations that is currently there. But then again, you need to go and wait and see what is going to happen. So on paper, yes, it looks like that. But you have to see what we clinically experience and whether that is going to happen or not. And again, the next 2 weeks would be extremely crucial for us to start to understand, is this going to this virus going to escape the immune system? Are you going to get reinfected? Is it going to escape the vaccines? What we so far saw for the people who has been vaccinated, mild disease.
Okay, let me come to a different set of questions before I end. There are some reports that suggest that Omicron may have first emerged in a person who was fairly seriously immunocompromised, perhaps an individual who had untreated AIDS. Could these reports, these theories be credible?
Yes, we have stated before in the past that the biggest problem or the danger lie with patients immune compromised, not treated, unvaccinated, or partially treated for their HIV status. That will be normally the patients where we're going to see these mutations happening. So it brings us back to the question, did this happen in Botswana? Did it happen in another country? And then brought into South Africa? Did it happen here? We don't know, and no one knows. Did it happen in Europe? We don't know.
In other words, these are all potential theories. They could be correct, but until the very person is specifically identified, we won't know for sure.
Exactly. We won't know. We will never know. And I think whatever country maybe know, with all the hype that is currently going around, they will never come out and say it was our country, this was the patient.
Absolutely. That's one of the dangers of overhyped countries are reluctant to say the first person was ours, because then in a sense they'll be blamed for starting the variant. And this is the great mistake the world makes when it overhypes the situation, because it ensures a lot of details you need never come. Two more quick questions. because this will reassure the world, what sort of measures has South Africa put in place to track the impact of Omicron over the next 10, 12 days, both in terms of transmission and in terms of serious illness? What sort of measures are in place to track both of those?
Daily reporting from hospitals, daily reporting from the labs, daily reporting from the doctors at the ground level who see positive patients. And then, that we have quite a good track system in South Africa. So that's very important. And then again, last night, our president emphasizes again the fact that you need to wear your mask, social distancing, the non-pharmaceutical measurements. And he urged those people who are not vaccinated to get their vaccines, and the above 50s can now go and get their third Pfizer booster, or the third Pfizer as a booster.
You've given me a very reassuring picture of the situation in South Africa, a picture that you've seen through your own eyes. It applies not just to the people as a clinician you've met yourself, but it applies to your colleagues in the Pretoria region and also to what you found out about the country as a whole, because after all, you are the chairperson of the South African Medical Association. Then, given everything you've said, how do you respond to the fact that countries are rushing to cancel flights from South Africa? They're literally banging the door on your country.
I know that is absolutely unacceptable. And I think it's a knee-jerk type of reaction the moment when they heard that there's 30 or more mutations. Unfortunately, our scientists need to give the facts. And we as clinicians at primary care level also need to tell you what we are seeing. We're not saying it's going to stay like that. It might change. 2 weeks from now, I might sit here and I might say to you, you know what, this is the worst infection I've ever seen. Or I might sit here 2 weeks from now and say more or less exactly the same that I'm saying now. We won't know. So then this reaction was really unwarranted and I think it's going to have serious implications going forward in terms of openness and transparency from other countries.
Can I put this to you? You're leaving open the possibility that we don't know what the situation will be 2 weeks from now. And you said it's possible, one hopes it won't happen, but it's possible this will end up being the worst infection with the worst disease. If that's a possibility, is it not wise to stop flights now so that you ensure that doesn't happen elsewhere? Or do you think that's also mistaken?
I think that's all speculation, and we need to give the facts as what we are seeing. It's a very difficult situation. As I've said, what we are seeing now currently, as in today, is not of huge concern to us. In this manner that we are being overwhelmed at surgeries, that doctors can't see, they can't keep up with the sick patients. We're not talking about the worried well that will now start to come into the surgeries as well, because they will definitely come now. But we are talking about sick people. And the easiest way to see how many people are really getting sick is to listen to the doctors at the ground level who actually sit with these patients. And then we need the scientists. We need them to work out the RR value, which we don't work out. And we all that's not part of how we are working. But we're not saying that the scientists are wrong. We're just saying, yes, it's the spreading pattern or the incidence are quite fast. It is so, but so was the Delta as well for us.
I'm very reassured, and I'm sure the audience will be very reassured to hear you say, and I'm quoting your words, today's situation is not a huge concern. We are not overwhelmed in surgeries. It's not that we can't keep up with sick patients. It is comfortable and manageable at the moment. In which case, my last question. Omicron has developed against a background of severe vaccine inequity, unjustifiable vaccine inequity. I gather only 11% of the entire African continent has had one jab. Only 7.2% have had two. Do you believe vaccine inequity underlies the emergence of Omicron?
Yes. So I want to say no one is safe until Africa has been vaccinated. And going forward, if Africa is going to be the stepchild and not help other countries, the richer countries, not reaching out and help those governments who are unable to get it rolled out and who have difficulties with this, no one can sleep safe. Definitely not the first world countries.
That is very clearly put. No one is safe until Africa is safe. And if you're going to treat Africa like a stepchild, then the rich developed countries will not be able to sleep safely. They're deluding themselves into believing that just because they have the money to double and triple vaccinate themselves, that they can actually make sure no mutations are created elsewhere, which then jump back and affect them. In other words, this is the time for them to think wisely, hand over vaccines to Africa rather than carry on triple vaccinating themselves. Would you agree, yes or no?
Yes, I would agree.
Dr. Coetzee, I'm extremely grateful for this interview. You will have opened the eyes of many people in India to the severity of Omicron. And as you said, it is perhaps everything you have seen as transmittable more or less as Delta. On severe disease at the moment, all the patients you've seen have a very mild disease. But this is only the 5th or 6th day. We need to wait for full 2 weeks to actually know the full picture. But you're hoping that the picture that's developed over 5-6 days will continue. And there is no pressure on hospitals in South Africa, leave aside ICUs. All of this is very reassuring. I thank you for this interview. Take care, stay safe. Goodbye.
Thank you so much.